Is pancreatic MCN a precancerous cyst? Imagine discovering a cyst in your pancreas and wondering if it could turn into something more serious. That's a common concern for many people diagnosed with pancreatic cysts. One type of cyst that often raises questions is the mucinous cystic neoplasm, or MCN. Yes, pancreatic mucinous cystic neoplasms are considered precancerous cysts. This means they have the potential to develop into pancreatic cancer if not properly managed. MCNs are usually found in the body or tail of the pancreas, mostly in women, and they are characterized by a lining of mucin-producing cells and a special tissue called ovarian-type stroma. Research shows that a significant number of MCNs can contain areas of high-grade dysplasia or even invasive cancer. Studies indicate that between 10 and 30% of these cysts may harbor invasive carcinoma. This variation depends on the specific criteria used for diagnosis and the population studied. The risk of progression from a benign cyst to invasive cancer makes it important to monitor these cysts carefully. Certain features can increase the chance that an MCN might become malignant. Larger cysts, especially those over 3 centimeters, the presence of solid parts or mural nodules inside the cyst, and dilation of the pancreatic duct are all signs that the cyst may have a higher risk of turning into cancer. On a molecular level, genetic mutations such as those in the CRAS, TP53, CDKN2A, and SMAD4 genes are involved in the process of transformation from a benign cyst to invasive cancer. These genetic changes happen step by step, reflecting the typical progression seen in precancerous lesions. Because of this potential for malignancy, doctors usually recommend close monitoring or surgical removal of MCNs, especially if they show high-risk features or cause symptoms. Surgery can often be curative if the cyst is removed before it becomes invasive. Even after surgery, regular follow-up is important to check for recurrence or new cysts. In summary, pancreatic mucinous cystic neoplasms are indeed considered precancerous cysts. They carry a real risk of progressing to pancreatic cancer, which is why prompt evaluation, careful monitoring, and often surgical treatment are key to maintaining health and reducing the risk of pancreatic cancer. If you have an MCN, it's essential to work closely with your healthcare team to determine the best approach for your specific situation. Always consult with medical professionals for personalized advice and management.